Now, the couple of interesting things there is you mentioned that you maximize their benefits with their insurance, if they've got that. You'll also put together a plan, and the plan keeps in mind their...
Oh, there have been many times where if people are missing teeth, and you should always replace the missing teeth. It's like a domino effect. Everything collapses from there. But it's overwhelming to look at, I've got to do all this in this year, this calendar year, and my benefits only cover this much.
Exactly.
And my dentist is telling me I better do it all. Well, you know what? I'm not opposed to, let's do this one this year. Let's do that one the next year. Let's form a relationship. Let's get, to know each other and develop a plan for a long-term relationship, not just to fix it this year.
And you have clients that go back a while. I mean, you've got, I know that you've been a dentist for, a few years.
17 years. Mm-hmm.
And
I was
so
a hygienist before that.
Wow.
And a dental assistant before that. And I actually have a family that was a patient of mine when I was a hygienist before I even went to dental school, waited for me to get out, and then found me with a name change, and our patients today.
Nice.
Isn't that
nice.
sweet?
That's really great. So you probably have done at least parents and some kids.
Oh, yeah. Oh, yeah. Oh,
That's
yeah.
awesome.
Families, and then we start to see who all they work with, because then we see all their work people, because they know that, they can come there and have their benefits, respected.
Do you work with businesses much? I mean,
it just happens that way. You seem to, if you get somebody that's got a good working relationship with their colleagues, then they say, do you know a good dentist? And then we start, like I said, seeing the whole office.
That's
and
really
seeing
good.
the whole family.
I so encourage, if you're a business owner, develop a relationship with Dr. Mary, because I know that even the last dentist that I worked with years ago, I met them because of a relationship they had with the HR lady. And so it was just a kind of just sprung out of that, and I think, wow, what a great benefit. Isn't just, hey, go out there, find somebody. It's...
No, we've had that. We've had a HR person direct many to our, grateful for those.
As we're moving into the closing moments here, I really want to look at what else would you like to tell any audience right now? Somebody is thinking about coming to see you.
That the I don't have insurance is a reason to stay away. A lot of times, if that's the philosophy, then what you have out of pocket is more than, even with insurance, than it would have been if you'd have taken care of it early. Example, you need a filling. You're not going to get the filling done because you don't have insurance yet. Waiting for those benefits, the issue gets bigger, and then you need a crown. So where you would have had to pay $50 out of pocket after your insurance for the filling, now you got to pay hundreds out of pocket after insurance for a crown. So I know it's natural human tendency to stay away, but preventive care is...
So what I'm hearing is, don't use that excuse.
Wait.
Don't use that excuse. Come, you guys have programs.
We'll help.
This is the Business Spotlight, and as we're wrapping today up, I just want to say thanks for watching. Like the Facebook for Dallas Laser Dentistry, Dentist, and this is Pat Dewar. We'll see you next time. Have a great week.
I've worked every position in the office. I've been a dental assistant, I've been a hygienist, and now a dentist. And it's made me a better caregiver on every level for my patients. One of the things I think I've learned over the years is where to put my technology money. You can buy the latest and greatest and it sit on a shelf, or you can figure out within your practice what's going to make the patient experience better. My practice offers several cosmetic procedures that are enhancing smiles with whitening, with Invisalign, the invisible braces, with porcelain work. So we see people's lives improve when we give them a beautiful smile. That's rewarding. The latest and greatest tool I have that keeps me excited is probably the Invisalign, invisible braces. It has allowed me to evolve my practice into a philosophy of move it, don't remove it. In other words, where I was before I had that tool, move it where I want it instead of putting something on top of it. Staying involved in dentistry on every level, local, state, and national, makes me a better dentist for my patients. I would hope that my patients would feel that from that phone call, even that initial phone call, all the way through to the end of their experience, that it was the best care they've gotten ever. When a patient, especially a very nervous patient with some dental anxiety, when they send their friends and family to us, then we know we've done a good job. That's the biggest compliment we can receive. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.
You can become a published author. Discover a system that will lead you from idea to having your book on the bookshelves. Bob Baer pulls back the curtain at the More Power to Publish workshop. Watch and learn how to follow the step-by-step plan to turn your idea into a published book. Learn more at morepowertopublish.com.